I'm concerned about the hospital itself in that it's not taking any admissions. And in particular, what I raised with the Minister was that they're still not taking the referrals directly from the GPs.
And this is quite ridiculous in some ways, isn't it? Because it means you have patients, elderly, many of them, who have to go all the way up to Mayo General to come back to Belmullet, so to speak.
It makes no sense whatsoever for the whole of Mayo. And I gave the Minister an example of a 95-year-old man who needed to be catheterised. The GP could have sent him up to the Belmullet Hospital 5 minutes away and did what he needed to have done up there, and he could have been looked after there by the professional staff there and everything else. Instead of that, he was forced to send him up over 100 miles round trip to Castlebar. He has to be admitted there for him to be catheterised there and then sent down again. Now, from two issues. First, on sending him all the ways up there, a 95-year-old man on the road that has to be travelled, the R312. And secondly, taking up a bed and staff in Mayo University Hospital, when we know that it's only a couple of weeks ago since we had 22 people on trolleys there. It just makes no sense whatsoever. And that's why I was raising it in the Dáil.
Now, there are additional primary care services that you say could be provided there in Belmullet, but they're not at present. And why not?
And this is why I was saying, are they using COVID as an excuse? Because the X-ray isn't being used, the chiropody isn't being used, the physiotherapy is very limited, and the eye clinic is gone as well. Now, why are all these services taken out of Erris? And that is the question.
Did you get any answers?
Well, it's the usual thing from the HSE and from the Minister. We're doing this and we're doing that and we're doing the other. And COVID. And I am sorry, but it just doesn't wash. If you were to ask somebody in Dublin to go 100-mile round trip to have their toes clipped, I know the answer that you'd get. So why is this the case in Mayo and why is it the case in Erris? It is absolutely ridiculous. Now, I hope by bringing it to the floor of the Dáil that it will put pressure on, that they'll see sense around that and that they'll take some action, both in terms of the services and in terms of the professional clinical judgment that's given by the GPs in the area, that they would appreciate that somewhat. The GPs seem to be just written out of the picture altogether. It doesn't seem to matter what they think as far as the Minister and the HSE are concerned. And also I raised the issue around family carers and the respite and family carers being given a break. But the major thing with the hospital is that there's works to be done there, there's immediate works to be done there, and there's capital investment needed there so that it can provide the services within the area. As what it said in Sláinte Care, that the services are to be provided as close as possible to the community. We just want the same as every other community. And they need to be honest with us, Teresa. We need some honesty around this. It's like death by 1,000 cuts in terms of Belmullet Hospital and in terms of the health services in Erris. And it has an impact not only on Erris, but on the whole of the County Mayo.